welcome those who are joining us in progress. All right. Well, welcome everyone. Thanks for spending time with us on this fine evening. A little festive this finds us for sure, and welcome to the third in a three-part series. We've been covering topics focused on manual dexterity and instrumentation and certainly handpiece technology. This event series is sponsored by our friends at NSK, with whom, without their support, we wouldn't be able to be here with a great speaker, a knowledgeable guy in every sense of the word. We're going to take you through an interesting presentation tonight focused on maintenance of your dental handpiece. Our speaker tonight is Mr. Glenn Williams. He's been a featured speaker not only this evening on your webcams and your podcasts and your mobile phones, wherever you're listening into us this evening, but also has been a recurring speaker at the CDA, at the California Dental Association meetings, both the North and the South, since about 2009. So he's been a frequent guest for them because of the relevance of this topic, and really excited to bring his expertise to all of you this evening. He's also done a whole article series in DPR focused on extreme handpiece makeovers. He's had more than 20 years of hands-on experience making sure that your lives as clinicians are running in shipshape and providing some guidance on how to keep your technology really running in top condition. And we're going to go for about 45 minutes of didactic talk, and Glenn's going to share with you a lot of recommendations on how to think about keeping your handpiece in top working order. And then we're going to open it up for some Q&A at the very end of the session. If you have any questions as you go, please feel free to use the chat tool or use the Q&A. And at the end of the conversation tonight, I'll collect as many of those questions and pose them to Glenn as we have in the time available. And we'll see if we can't provide some of that guidance and insight along the way. We're going to take a couple of live polls, and we would love it if you would stick around through the end of the event and share your feedback in the post-event survey so we can continue to shape meaningful exchanges for yourselves, your peers, students around the country. And so if you have any questions, please feel free to hit me up in the chat window. But otherwise, it's my pleasure to introduce you to our speaker this evening, Mr. Glenn Williams.
Thank you, Rich. Welcome, everybody. Did you want to talk about this, Rich?
Sure. And if you are willing to participate and be an active poll taker and survey taker, we are going to draw one winner at random from those participating in the series and the chance to win a free iPad. So it's worth your while if you do stop and share that feedback with us and allow us to continue to bring meaningful educational events just like this to you. You got to be in it to win it. And as I mentioned, Glenn is our speaker tonight. I'll let him demonstrate his expertise for you in just a few moments. But as I mentioned, he's been a very active contributor in dentistry for the last 2 decades plus, has a great set of experience and wisdom to share with you all. I'm sure that he'd be willing to answer questions you pose through the website, his myhandpiecerepair.com website at the end of the session. And the last thing I'll say before we get underway is a special thank you to our friends at NSK for bringing all of this great activity to your doorsteps tonight. So with that said, Glenn, our students are in your hands.
There we go. Well, welcome, everybody. As Rich said, I have actually about 33 years in the dental industry. I was a representative for Star Dental for my first 10 years, and then I left and started my own business doing just handpiece repair. So I'm going to come at the angle tonight that I don't think handpieces get enough respect. These are tremendously precision little machines that you have in your hand. And a lot of people don't know this, but and of course my wife says I'm a handpiece nerd, but that's what you got tonight. The dental handpiece is the or let's say the dental burr that's being run by the handpiece, that's the fastest moving object on planet Earth. And so I would normally pose this as a question, but since I can't see you, I'll just tell you, you're talking about average speeds of 450,000 RPMs, and to put that in another context, that's 6,000 revolutions per second on the burr, and it's mind-boggling. So you have these, beautiful precision instruments. Now this is an electric handpiece, and you can see inside the electric handpiece, there's much precision machining and extremely tight tolerances. So you've got some tremendous technology that's taking place here. But then you guys take these beautiful little machines and you stick them in people's gross mouths, and then we cook them in a sterilizer for an hour, and then everybody gets upset when they break down. So my role as the guy who fixes handpieces is to become the defender of handpieces. I think they get a bad rap, and I think they do a fantastic job for what they do for you. So I want to start off with a little test. It's not advancing, Rich.
Just click on the PowerPoint. There you go.
There we go. Okay, sorry about that. Tonight we want to cover ways that in practice we can save money on repairing handpieces. We can hopefully make them last longer. That's going to save money. We want to increase the life between repairs so you get more use out of the handpieces. I would like to share basically how handpieces work, what's inside there, what's going on, and we want to improve hopefully the skills and just understanding more about the handpiece. That's such an important part of your dental practice. So here's the test. Raise your hand if you think handpieces break down a lot. And of course, when I'm doing this in a live setting, this is the number one, stereotype is that my handpieces break down all the time. They're problematic, they're high maintenance, and they're a problem in the practice. And I want to try to dispel some of that. So I think the biggest problem, well, here's a test for you. What color are your handpieces? And so a little hint, of course, they're silver. So I'm having a little fun, but the problem that I think happens with handpiece repair is a problem of perception. Because handpieces are all silver, they all tend to look the same if you're using the same brand. There's just this idea that, geez, I'm always sending them in. And I'll give you an example. Yesterday I opened a box from a customer, and they wrote, this handpiece is still under warranty, we just had it repaired, and that's what they wrote, just repaired. So when we look it up by the serial number, the last time we had it was in 2015. So, even a 1-year warranty would have been expired, but that's just the perception. So the first thing that I bring to the table is a way of kind of tracking your handpiece repairs, and what I want to do here is take stress out of the dental practice. So this is very low tech, and Rich will probably laugh at me, but this is just a simple little book that we produce. I feel like if it's not low tech, nobody's going to take the time to use it. So it's just a log book, but what you'll see on the right hand picture there is we want to record each handpiece by serial number. It might seem like common sense, but in the heat of the practice and everything that's going on, people do lose track of what's happening. So you can use anything, but this is something that's simple. You just put the date, what was fixed, what was wrong, what was done, how much it cost. And the thing about this is you're tracking each handpiece individually by the serial number, and so it's very easy to visually see, bang, this one's been in every 6 months, or this one hasn't been in for 2 years. And it takes, again, when you look at that page and you see it's only been in 4 times in the last 10 years, you're thinking, okay, this handpiece is working good. So that's just a way of taking some stress out of keeping track of handpieces. So the next thing we want to talk about is what's going on inside the handpiece. I'm just going to grab my pointer here. So there's some confusion, and I want to be really clear about the words that I use or that we use in the handpiece business. So a dental handpiece, and let me qualify that. I'm going to start out talking by simply air handpieces, and that would be the high-speed handpiece, which is most commonly used in the practice. We'll move into electrics later on in the program, but a dental high-speed handpiece that's air-powered has one moving part, and that's this part here. It's what we call the turbine, and then the turbine is made up of these components. You've got the spindle, chuck, burr tube, rotor. These are all words that are used to describe this main piece here that holds the burr, and then there's always 2 bearings and there's always 2 O-rings, and the O-rings provide a support capacity. So inside the handpiece head, this is what the turbine would look like positioned inside any hand. They're pretty much, all of these components, everything I'm talking about is pretty much the same across the board. Each manufacturer is going to vary in the kinds of bearings they use, the types of O-rings they use, the types of preloading springs or washers and shims that they use, but basically, you know, a turbine pretty much works the same way. So you've got your upper bearing, lower bearing, and those are always going to be supported by some type of an O-ring. In this case, you see that this O-ring has 4 sharp edges, so it's called a quad ring. It's got a square cross section. The O-ring provides vibration dampening and noise dampening. So that's what helps keep your handpiece quiet. It gives it a bit of a shock absorber. And then what else you'll notice when you're using the handpiece, when you're putting lateral pressure on the surface of the tooth, that burr does have some flexibility, and that comes from the support O-rings. So they're supporting the bearings. The bearings are the main component. We're going to talk about that next. But the red part that you see here, the impeller, it's also referred to as a rotor. That looks like a little water wheel or fan blade, and that is catching the jet of air that's coming through here, and that's what's causing that burr to spin. So that's what's going on inside the handpiece. So let's talk about bearings. Bearing, and this is across the board. All bearings are the same, essentially. You've got an outer race and an inner race. And whether you can see it from the picture or not, that's a groove on the inside of the outer race and a groove on the outside of the inner race. And what that does is it creates a track, and then your balls are traveling in that track. They are trapped in between the races. That keeps them in the pathway. And then the thing that keeps the balls from banging into each other and keeping them straight and smooth is called the retainer. And another word for that we use in the industry is cage. So bearing cage, bearing retainer. And that's really the most key or critical component of any handpiece. The bearing retainer is what actually breaks, and I'll show you an example of that. So the outer race is what's stationary. It's fixed into the head with those O-rings. The inner race is what is pressed onto the burr tube, and it's allowing the turbine to actually spin. And then, and I'll just say this, in a dental handpiece, the ball bearings that we're talking about are 1 millimeter in diameter, and the typical cross-section of the outer race is 1/4 of an inch. So they're defined as miniature precision bearings, and that's what they are. So this is what it would look like, all of those components put together. And so you can imagine in those kind of tight tolerances and small spaces, any debris or grit that gets in there is going to affect not only the life of the bearing itself, but it's going to affect the performance. When you're trying to use it, you're going to feel that. And maybe if you're in clinic, you've felt, you know, grittiness, and that's a sign that the bearings are wearing or starting to go. And of course, the more we can clean and lubricate the handpiece, the longer you're going to prolong the life of the bearings. Here's a shot of as I said, the burr tube is what's holding the rotor. Rotor can be called an impeller, and that is one assembly. And inside the burr tube, you've got your chucking mechanism. In the old days, you know, you used a wrench to change the burr with a physical chuck, and now just about everything is a push button. So then we're going to mount the 2 bearings onto that burr tube, just like this, and that's going to provide the complete turbine assembly when it's all put together. Now, here's the thing. We all know that sterilization is going to take a toll on your handpieces, and I think this illustrates exactly, it's a great illustration of the kind of toll that takes place. So on the right-hand side, you got your brand new pristine turbine, this Midwest tradition, and you can see the same turbine after months of use and autoclaving. You get wear, you get rust, corrosion. You can see the O-ring from bright blue. The O-ring is discolored, it shrinks, they harden. These are all the kinds of things that contribute to the wear factors of your handpiece. So this is the cage that I was talking about, the bearing retainer. And you can see when it's brand new, the holes are uniform and they are completely round with clean edges. You can see this is coming out of a handpiece that's had a good amount of use. And what's happening, the holes are starting to elongate. They are irregularly shaped. You can see troughing occurring on the outside of the cage where it's tracking, it's out of line. So in this case, clinically, this is going to manifest, you're going to hear a louder sound you're going to feel more vibration, you're going to lose power, and you're going to have way less concentricity. So the burr is going to be kind of jumping around on you as you're trying to cut a nice clean margin. And then on the far right, we have what we call, catastrophic failure. At this point, your handpiece is no longer functional, and when we open our boxes, it says notes like, frozen, locked up, won't turn, and that's time to send it to the handpiece guy. So we want to keep that from happening just as long as possible. All right, so
time for Mr. Groves. All right, folks, I just wanted to take a quick poll here, if you don't mind indulging us. Glenn and I would just like to have an idea from what point you started with your understanding of handpiece technology. And so before this night, did you have a deep dive? You had a full understanding of how this instrumentation functions, or perhaps less so? We'd just like to take a quick poll here and see what everybody's thinking. Answers are coming fast and furious. Okay, still coming in. Sorry for those of you who are listening on your mobile devices. I know you can't participate in the poll, but thanks very much for coming and sharing in the wisdom. All right, we're going to leave this open for just another couple of quick seconds so you have a chance to finish your answer. Okay. All right, folks, just as a side, we've got an audience that's still looking for a little bit of information, Glenn, so it looks like we've got to go on.
We had to keep going, huh?
Yeah, got to keep going. People said they're thirsty for some more.
Can I do that little history lesson we were talking about earlier?
Yeah, absolutely.
All right, there's not a slide for this, but I just think it's important to pass this on. So I'm a little older than Rich, apparently, and I asked Rich if he knew the history of sterilization in the dental industry. And I'm sure you guys are going to laugh, because I know that in clinic or in dental school you're learning all about the proper procedures for infection control, but there was a time when it wasn't that way. And so the idea of autoclaving handpieces never occurred before 1992. And if that shocks you, that's what I'm here for. I just want to know, I want you to know where we're coming from. So and I was working for Star Dental at that time as a manufacturer's rep, so this night is burned into my mind. But on May 20th, 1992, both CBS Street Stories and NBC Dateline, on the same night, they both did exposés on the fact that dentists did not sterilize their handpieces. And whether that was coordinated or not, who knows, but it put the entire dental industry into such a turmoil. It was amazing. So here's how it affected handpiece companies and me personally. What happened then, every patient who watched both of those shows, the first thing they did on the next morning, which was a Friday, is they called their dentist and they wanted to make sure that their dentist was sterilizing their handpieces. Well, I'm sure that the dentist did not want to say anything untrue, so they said, yes, of course we are sterilizing our handpieces, and I think they started that day. But the problem with that is the redundancy that's needed, because when you're sterilizing handpieces, typically the setup is 3 per room. So we would say that 1 is in use in the operatory, 1 is going to be in the sterilizer, and 1's going to be cooling down. So in order for the average dentist, let's just say you're working 3 rooms, you're going to need at least 6 handpieces up to 9 in order to keep that going. So every dentist in America placed orders for handpieces on that day, May 21st. And what happened is I was on the West Coast, Star Dental, my company, was on the East Coast, and we were shipping from stock. The whole time I worked there, we shipped from stock. Well, every dentist called their dealers the first thing as soon as they opened to order handpieces on that Friday morning. And by the time it went from the 3-hour time difference to the West Coast, my company went from shipping from stock to a 6-month back order in 3 hours. Excuse me. So that's it's just kind of amazing that we all take it for granted now. We take it, gloves, masks, all that stuff. It wasn't happening I began in the dental business in 1984, and at that time it was just becoming, controversial that dentists would have to wear gloves. So anyway, I just wanted to take you down that path, a little history. It took us about a year to actually catch up on all the orders of handpieces. And so, yes, I made a lot of money that year. But anyway, that's the history of dental handpiece sterilization. And none of these factors that we're going to talk about next were ever an issue before that. Handpieces pretty much lasted years before breakdown. So, all right, thanks for indulging me, Rich. I just think it's important to share the history. So
you bet.
All right. So I want to talk about variables. We talked about what's inside a handpiece, how it works. We want to talk about now, how are we going to keep it going and what things affect the life of your handpiece. And of course, I listed number one, air pressure. That's probably the most, has the most effect on the life of your handpiece. I'll talk about that in a second. Obviously, maintenance and lubrication would be a strong number two. The type of sterilizer you're using and how you perform sterilization, that is a big factor. Whether you're using a chemical wipe down on the handpiece, which I have very strong opinions tonight, and you'll get them for free. So that's a really bad thing. We don't ever want to use chemicals on a handpiece. And then there's other things that are sort of outside your control a little bit, like the type of practice that you're operating. So, for instance, a prosthodontist who's doing heavy crown and bridge all the time, all day long with handpieces, they're going to burn through their handpiece more than let's say a pedodontist who's or an orthodontist who's just removing cement or something. So the type of practice you have, the number of handpieces you have in rotation is going to affect, how long they're going to last, and how tight your inventory is going to indicate how much of a crisis you're in when a handpiece actually breaks down. So let's talk about air pressure first. Air pressure is very important for two different reasons. Number one, as we talked about, these tiny precision bearings in there, they've got a certain operating envelope. And if you take them past the recommended pressure, then you're pushing them beyond their limits, and you're going to experience a much accelerated failure. If it's happening, if I just did the repair and it's under my warranty, I'm going to be very interested in what your air pressure is. So if I'm paying for it, that's a big thing. If it's on you, then you would be concerned about the amount of money that you're spending on repairs needlessly if your air pressure is set too high. So there's a little gauge on your dental unit that's usually a small rectangular needle type gauge. They are not very expensive. They're not good quality. They're sort of like an idiot light on your dashboard. It's more of an indicator or on off, like yes, you have pressure. It's not really an accurate measuring device. And the gauge that you see pictured here, this is like a $250 Ashcroft gauge, and it's designed to work in line. So this end screws into the handpiece tubing. Your handpiece then is threaded into this coupler here, so that what you're getting is an extremely accurate reading right in line from the air pressure of the hose into the handpiece. And the reason that's important is because you have frictional air loss as the air travels through the tubing. Just like electricity has resistance as it goes through the wires, you're going to lose as much as 6 pounds of pressure just from the dental unit to the handpiece. So even if the unit gauge was accurate and giving you the correct pressure as the air is leaving the unit, you're not getting the same pressure into the handpiece. So we always want to have this gauge to check your handpiece pressure. I don't expect, and let me say that again, I don't expect you to purchase such a gauge and have it, but every service guy in America has this gauge on their truck. They're just too lazy to use it. So you got to tell them, hey, go get your gauge and check my pressure right. And they will, but everybody's in a hurry and they don't always do that. So it's something that you do have control over. The adjustments are all usually on the front of the dental units. They're usually very simple. It's usually a small set screw with an Allen or sometimes a small screwdriver. But you should be able to individually control the pressure on each handpiece line, and each handpiece manufacturer is going to provide their specifications for the optimum pressure. So that's a big one. And let me just talk about the others. If your air pressure is too low, then you are not getting a good value out of your handpiece. If you're going to spend, $1,500 on a high top-of-the-line handpiece, you would want to get the proper performance. And if your pressure is too low, it's not going to cut, and you're going to be very unhappy with that product. So it needs to be good for both reasons. Next thing to talk about is maintenance and lubrication. So some of these are you might laugh, some of these might sound dumb, but I will try to give you examples of each one. So some of the factors: how often should you oil the handpiece? Where does the oil go? There's two types of oil. There's a dropper type of oil and a spray oil. And just using the correct tip on the oil can is an important factor, which you might think is so simple. But how much oil should you put in? Should you run it to remove the excess oil? Answer is always yes. What about the type of oil? That's a factor. Does that matter? Yes and no, and I'll answer that one in a little while. And finally, what about automatic lubrication machines? You've probably seen them on the market. Expensive, waste of money, or good value. You know, those are things that you have to decide. So let's start out with how often, or the correct procedure. How often you lubricate your handpiece is every single time you autoclave it. And the procedure is universal now. Every manufacturer has come out with the same exact protocol, finally. There was years where they were different, but now it is simply spray, run out the excess, and then autoclave the handpiece. So that is, and again, every time the handpiece is used, this should occur, and then you're going to autoclave it before using it the next time. Where do you put the oil? Well, there's the terminology is a 4-hole handpiece or 4-line handpiece, and these are the 4 lines. And the biggest opening is always your exhaust, because you don't want back pressure building up inside the head of the handpiece. That's going to slow the turbine down and decrease its performance. So that means that the smaller of the 2 large holes we call the drive air. That's what drives the turbine. So that's where the air is going in under pressure. That's where we want to place the oil. You see that right here in this picture. The other of the 4 holes are water. So this is your water coolant right under the drive air line. And on this side you have what we call the chip air. And the chip air isn't really used as it used to be in the old days, but it is used by many companies to disperse the water, atomize it, so you get a very clear mist. And then if you're wondering what the 5th hole is up here, that's the fiber optic. So that's the glass that transmits light through the handpiece. So that is a universal rule. You always lubricate only in the smaller of the 2 large holes. Okay, dropper or spray. Here comes your first strong opinion. Never use a dropper. You know, if we were live, I would love to demonstrate this. I can't do it here, but what I'm going to tell you is this. If you put a drop of oil or 3 drops of oil in the wrong hole, for instance, you accidentally put it in the exhaust and then you hook the handpiece up to run it, the air is going to travel down through the head of the handpiece and blow all that oil out the exhaust. It's never going to get to the bearings. So my other example would be, if you're using a spray aerosol, I'm going to tell you to spray it until you see oil dripping out of the head. So even if you put the tip in the wrong hole and you spray it until you see oil dripping out of the head, you know that those bearings are saturated. So I'm a guy that likes to take all the variables out. So using a spray can removes that variable. With a dropper, you're not getting enough oil in there. It's not penetrating to the bearings. You're relying on the pressure of the air to drive the oil to the bearings, and it's just, in my opinion, it's a bad way to go. So aerosol would be the way to prolong the life of your handpiece. Using the proper lube tip, and this one might sound ridiculous, but you know, here's a real story that happened. We had a great customer using electric handpieces, and you know, regular, good maintenance, no problems. All of a sudden, we start getting warranties in, which, you know, that's a signal for me that something is wrong. So we call, you know, everything okay? Are you guys doing everything? Yes, we are. They're very conscientious. I had a relationship with the office, so we believe them. But I got in my car, I drove out there to see what was happening, and they said, yes, we're oiling them every single time. We're not doing anything different. And that was all true. But what happened was that doctor had purchased new handpieces of a different brand, and I'm going to circle this little. So this little tip here is what I'm talking about. The new handpieces came with a tip that looked very similar to the original tip that they had. However, the new handpiece had a little step on it here, and it prevented it from going all the way into the original handpiece that they owned. So basically what was happening, they were squirting oil into the base of the handpiece, but it wasn't penetrating, and it was blowing it back out the bottom. They were never getting oil through the handpiece into the head. And so by nobody's fault, it's just that they bought a different kind. It came with a different kind of oil, a different kind of tip, and it led to a lot of problems. So these are the kinds of dumb things, you know, that's what I'm here for. I try to figure out what's going on and take out the variables. So even using the wrong tip can be a problem. I will say that I do like this system where almost every handpiece that has a swivel or quick disconnect, it comes with some kind of an O-ring sealed tip. You can see the black O-rings on that tip. What they do is they lock into the grooves that are on the inside of the handpiece, and you actually are pressurizing the handpiece, and it's forcing all the crud out of the turbine. So that is the best way to lubricate a handpiece, having a nozzle that actually snaps in. Why do we want to run out the excess? We've got a few reasons here, and you know, number one, if you oil the handpiece and then you put it in the sterilizer without running it, you're just creating glue. You're baking the oil into those little tiny ball bearings, and you're not doing anybody any favors. We also don't want the oil to expel into the patient's mouth. If you're doing cosmetic dentistry, you certainly don't want contaminants in the field there. And so the conundrum is, if you're lubricating handpieces in the operatory, you have to spray it and then run it on the hose. But most offices don't want that to happen. They want the operatory being cleared for the next patient. So then the assistant is taking the handpiece back to the sterilizing area and then lubricating it, but then you have to go back to the operatory to run it. So this is a solution, these little flush stations that are very inexpensive. All it requires is a air hookup right here. You can see it usually in the sterilization or lab area. And you spray the handpiece, and then you simply seat it down on this for maybe 15 or 20 seconds. Gives it a shot of air that runs out the oil. So these flush systems are a very practical answer to trying to run out the handpiece and make it more convenient. All right, the next question. Does it matter what kind of oil that you use to lubricate your handpiece? And I would say the answer is yes and no. So if the handpiece is under the warranty from the original manufacturer, so you just bought it, it's brand new, you've got to use their oil, because if you don't use their oil, and they always say they can tell, I don't know if they can or not, but we don't want to give them any excuse to void out your warranty. And there are companies that will say, nope, no warranty because we can tell we did a pH test and you're not using our exact spray. So as long as it's under their warranty, do not take any chances. Once it's out of warranty, then I don't care. I don't care if you use baby oil or vegetable oil, you've got to oil the handpieces. So I really honestly believe it doesn't matter what kind of oil that you use. There's all kinds of claims, but you know, from a cost standpoint, this can here is $80. This can is $40, and this can is $15. So and I think it works just fine. You know, you don't always have to buy the most expensive thing, but you do have to use it. All right. And I want to talk about automatic lubrication machines. You see these on the market. The prices range from $1,800 up to $3,600. So you can spend quite a bit of money on these guys. Is it worth it? Well, I'm just going to review the pros and the cons, and I'll let you decide for yourself. I don't have an opinion about this. It's whatever works in your practice, whatever gets the job done. So the positives are you have a fully automatic machine. You snap the handpieces in place, you push the button, and you walk away. And that means that there's no staff involvement. Staff has better things to do, such as cleaning and getting ready for the next patient, bringing the next patient back. You can do multiple handpieces at one time. So it's simply you're snapping them in, closing the cover, push the button, walk away. Where if you tried to lubricate 3 handpieces by yourself, it would take you longer. There's a consistency here that a lot of people feel very good about. Gives you peace of mind knowing that the machine is giving you the measured amount every time. It's the right time every time. And the manufacturers, of course, they want to sell these, so they will extend your warranty. A lot of the companies, if your handpiece comes with a 2-year warranty, they'll go 2.5 if you purchase their machine, and of course, they're very expensive oil. So those are the pros. On the con side, you know, you're talking about a lot of money, up to $3,500. It does take up counter space. That's some pretty valuable real estate when you get into some of the smaller offices, labs, and sterilization areas. It's a job that's not that hard to do, spraying oil and running it out. It takes a little time, but it's not that hard. And then it's important to point out that it's not fail-safe. So over here on the pros, we said it was consistent, but I have another office where, again, a good office, very consistent maintenance, never any warranty issues. All of a sudden, we're seeing their handpieces every 4 weeks. So I call down, you guys doing anything different? Nope, nothing different. So I get in my car, I drive down there, and the machine they had a plastic reservoir where the oil went, and it had developed a leak. It took a while to figure this out, but anyway, the plastic reservoir cracked, and the oil was dripping out the back and running down behind the counter where nobody could see it, so they didn't know they had a failure, and basically no oil was going into the handpieces. They were replenishing the reservoir because it looked like it was using up oil, squirting the handpieces, but it was just all leaking out. So, nothing is foolproof. So don't think that if you buy a machine, that's going to take care of all your problems. On the next slide, I will talk about what to look for if you're shopping for an automatic lubrication station. You want one that's fully automatic. So you push a button and walk away, so you can do it. There's one that's for sale that you have to stand there and hold the button down. Well, to me, that's not automatic. That's kind of pointless. If you're trying to free up time, you don't want to stand there holding a button. You'd like to buy one that does many attachments at once, usually 3. Also, some of them don't have a place to put an electric motor or electric handpiece. There are 2 on the market that offer an actual motor that will run your electric 1 to 5 handpiece, where the air ones will not. So if you're using electric handpieces, you have to make sure that you have a tiny motor in there that's going to run the attachment. And then there's a couple of them on the market that have an electrical connection. So for instance, if you had a low oil reservoir, you'd want a warning sign, either a light or a sound that's going to alert you to a problem. So most of these machines just plug into an air connection. They don't plug into the wall. So there's 2 I know of that do have the electrical wall plug, and I think that's a great advantage. And then the other thing that's really nice is a chuck cleaning attachment. I don't think I have a picture of that, but there's a 4th little orifice there that actually blows oil right into the mouth where the burr goes. Really good idea to clean and flush out the chuck. So that's my spiel on lubrication machines. And now that we've talked about lubrication, I just want to bring up the fact that there are some lube-free handpieces on the market. So this happens to be a Star handpiece. I was with Star in 1990 when they introduced the lube-free. And the secret is it's not really lube-free. What's happening there is the bearings are packed with autoclavable grease. It's in there from the manufacturer. And every time you use the handpiece and sterilize it, a little bit of the grease is going to leak out of the bearing. It's going to lubricate the bearing, but it's going to eventually deplete. And when all the grease is used up, that's when the bearing will fail. So to say that it's lube-free, it means that you don't have to oil it. It's maintenance-free. And it's got some advantages. Again, you're not spraying extra oil into the field, where you're working. Nothing is expelling in the patient's mouth. So it has proven very popular with Star. I think there's only one other manufacturer that makes it lube-free. That's a Midwest Stylist. So it hasn't caught on, across the industry, but it is offered in some handpieces. So, and the message here, it really is lube-free. You do not want to oil a lube-free handpiece, because if you spray oil into it with an aerosol, you're going to wash out the grease that's in there, and that's going to lead to failure more rapidly, which might seem counterintuitive, but you don't want to oil a lube-free handpiece. What you do want to do, though, is clean out the chuck. So here's something that Star didn't think of. Inside that chuck mechanism are tiny little sharp gripping wedges and a little tiny coiled spring and a button that actuates it. And so without oil being regularly put through the handpiece, they do tend to get rusty and sticky. And we have a lot of Star customers that have trouble with, it's hard to push the button, it's hard to get the burr in, it's hard to get the burr out. So there's a little protocol that Star came up with just to clean out the chuck once a week or so, is to put it 1 drop of oil where the burr goes, and then use a proxy brush, and just, the first time you do this, it'll come out black with debris. And it's really good for any handpiece. It's not, Star sort of pioneered it because they were having the most problems, but I would recommend it for any handpiece to clean out the chuck about once a week, and that'll really prolong the life and make it easier for you in terms of inserting and removing the burrs. All right, now we're going to talk about sterilizers. That's another variable. Does it matter the type of sterilizer that you use? And the answer there is a resounding yes. And I do have strong opinions about this. Sorry. I don't work for Sycan or Statum. I don't sell them. I don't have anything to do with them. But this is a cassette-type autoclave, and it is a huge handpiece lifesaver. So the difference between a conventional autoclave and a cassette-type autoclave is this. In a conventional autoclave, you've got a chamber that's being heated, and the chamber it's at a certain temperature, and then when you push the button, or if it's automatic, either way you push a button, but anyway, when the cycle starts, it dumps water into the heated chamber, and so the water, when it hits, it immediately, it cools down the chamber, and it takes a certain amount of time for that water to turn into steam, and we call that rise time, and it can be as long as 30 minutes. Once you get up to the correct temperature and pressure, now you have your kill cycle, which could, 6 minutes, 12 minutes, depending on what you're sterilizing and whether it's bagged or not. But then when either the machine is automatic and it cycles down, so then all of the pressure and steam has to bleed out of the chamber. So that's another, that depressurization time is another, 20 to 30 minutes to get it back down to where you can open the door. So your handpiece is being exposed to heat and water and pressure for as much as an hour. Well, that's not good for these little precision machines. So on a cassette autoclave, and I'm not just promoting, right now I think there's another company on the market that makes them mid-mark, but Statum pioneered this a long time ago, and they just work great. It's completely different technology. You've got a cassette, which is like a little tray that slides in, and that is it is sealed with a gasket, and there is no rise time. There's a boiler inside the machine that is it already has the water at steam temperature, and what they do is they suck out all the air out of the cassette. They inject the steam. You've taken away the rise time. It goes straight to steam in there. By taking all the air out of the chamber, you cannot have oxidation. Without oxygen, there can be no rust or corrosion that takes place. You have a short cycle of 12 minutes, and at the end, there's no downtime. The same little pump just pushes all the steam out of the cassette. You pull it out of there, and it's ready to go. Handpiece is very hot, but it's completely dry, and it has not been subjected to all the detrimental factors. So, huge fan of cassette sterilizers. They just make they do prolong the life of the handpieces. Here's a tip on your conventional autoclaves. If you're using a paper-plastic combination bag, which is what we see the most of, we want you to put the handpieces in the chamber with the paper side up, because we want that steam, it's going to be full of steam in there. When it cools down, we want that to evaporate out through the paper and not condense, onto the handpiece. I was in a situation where I was called into an office on a Monday morning, and they had left the sterilizer closed and locked over the entire weekend. So, and all the bags were the other way than you see here. The paper was down, the plastic side was up, and all of that steam turned into moisture, and you had like a bunch of little rainforests, and the handpieces were just sitting immersed in water for the entire weekend. So that's not what you want to do with your handpieces. So paper side up is a rule. And then another little trick you can do is after sterilizing, we want them as dry as possible. And a lot of offices do not want to spend the time to let the handpiece go through the drying cycle. So they pull them out of the sterilizer. They're hot and they're wet. They run them under cold water and run them up to the operator so the doctor can use them. That means you don't have enough handpieces. We want them to dry naturally. We want you to use the drying cycle, and then even more drying, you can take them out of the hand sterilizer and lay them on top where there's still a lot of heat, so they can continue to evaporate and get fully dry until it's time to use them. So those are some sterilization tricks. As I said before, no chemical wipes of any kind. It's redundant and useless. The term sterilized means absence of life. So there's no reason to wipe something with a disinfectant, which doesn't kill everything, when you're going to kill everything, and you're just introducing chemicals in there that's going to get inside the head, inside the bearings. We can see when people are using chemicals because when we open the handpiece, there's just a beautiful white crystalline field in the bearings and everything. Rich, are you? I can't hear you.
Just one more, please.
What's that?
Click for me, please. We're going to set up our next poll, folks. We know that the evening's drawing to a close, but we'd like to take a quick temperature and see who's using what type of handpiece in today's, in your clinic today, in your practice today. Are you an air-driven? Are you an electric? Or perhaps you're a not yet applicable for us. Thanks, everyone. Answers coming quickly already. Good. A couple people still to answer. We're going to get to our Q&A in just about 5 or 10 more minutes. We're making good time here, but Glenn's got a couple last insights to pass along to you as soon as we close this bad boy. Any last comments, folks? It's your chance to get them in, about 5 more seconds or so, and we'll share and continue on. Okay, mostly air-driven today. All right, thanks, everyone. All right, the show is back to you, Mr. Williams.
Okay. All right, speaking of electric handpieces, what a great segue, Rich. We see that in our business. We started really repairing electric handpieces about 10 years ago, and went from 0 in 10 years. It's about 18% of our business now. So what it's really going to take for electric to overcome air is for all the dental schools to switch. Once you learn on electric handpiece, you'll never be able to go back to air-driven. There's a lot of advantages. I think we'll cover that as we go forward here. The one thing about electric handpieces is we're going from one moving part to lots of moving parts, lots of really tiny tolerances, and there is some potential for patient injury. Maybe you've heard that, but there's been several FDA rulings on, guidelines they're called, where patients have been severely burned by practitioners that are using electric handpieces improperly. I'm going to stick up for the handpiece here. You know, the handpiece is just a tool, and you've got to watch out. But here's the problem. If you've worked with air handpieces, you know that they have virtually no power. If the handpiece isn't working properly, it's useless. You put it against the tooth, and you just throw it on the floor and say, I can't use this, get me another one. So air handpieces have relatively little torque compared to electric. And when I use the word torque, that's I guess to say it's the amount of pressure you can put against the burr before it stalls out on the tooth surface. We measure that in ounce inches when it comes to scientifically measuring that. But an electric handpiece has a virtually unlimited torque because it is driven by an electric motor. And so the problem when patients get burned, it's because the dentist is not recognizing that the handpiece is malfunctioning, and that electric attachment will continue to turn, that motor will turn that until the bearings are literally ground into dust and the gears. We get them in sometimes, and they should have been sent in months before. So this is a little safety tip that we want to pass on. When you're using an electric handpiece, feel, listen, touch. It's pretty simple. When you put the burr in with your fingers, you should be able to turn it with your fingers, and it should feel pretty smooth. Now, you are turning gears. It's not going to ever feel as smooth as an air handpiece, but you should be able to turn that without a lot of grinding or grittiness. So that's your first test. Just listen to the electric handpiece before you go on your procedure, and make sure it sounds quiet and smooth. And then touch. I don't like this picture because they're touching the head of the handpiece with a gloved index finger. And what I would say to do, I want you to come back behind your glove and touch the button or the head of the handpiece to your wrist. where we test for baby's formula. That's a very sensitive area of the body for heat, and you're not going through a layer of rubber. So obviously you're not going to do the touch test before you start using the handpiece. It's going to be room temperature. But after using it on the patient, next time you change burrs, maybe just give a little touch to your wrist, make sure that it doesn't, if it's hot to you, it's hot to your patient. And the reason why there's third-degree burns is because you're in the mouth with the handpiece, the patient is numb, you're getting against the buccal tissue, and the patient's being burned and doesn't even know it. What happens that night, they develop a tremendous pain after the anesthetic wears off. You get the phone call, hey doctor, my mouth is really hurting. They come in the next morning, and what you see is some perfectly round little charred circles where the cap of the handpiece was going against the buccal tissue. So I'm not trying to scare you, I just want an awareness to be out there that electric handpieces have the capacity to injure people where air handpieces really don't. So enough of this scary stuff. But inside an electric handpiece, there's more going on than an air handpiece. All of them have the same components here. You've got the head cartridge, which would be like a turbine, but everything is gear driven. So at the bottom here, the input assembly, this drive dog is being driven by the electric motor that's back here. This is your increaser. So these are called 1 to 5 increasers. The motor is turning at 40,000 RPMs. This large gear is turning against this small gear at a 5-to-1 ratio. So up here at the burr, you're actually getting 200,000 RPMs. So that's how an electric handpiece works. Different here it is cut away. Same handpiece, you can see what's going on. There's a lot of gear interfaces. There's a lot of bearings there's some you can't see. So there's a lot going on in there to make that electric handpiece work. Same thing with maintenance. You're going to use the proper lube tip over here, and you're going to insert that. You're going to get a positive click, and we would say just spray it until you see oil running out the head, because you have to lubricate all of those components going through the handpiece to get up to the head. And talking about low-speed handpiece maintenance, low speeds are not the glamour product. We are always talking about the high speeds and electrics. Low-speed motors, they don't need a lot of oil. You're talking about 5,000 RPMs. They're not turning that fast. Just a couple drops of oil, maybe once a week or so. The problem with low speeds, if you oil them too much, you're just creating gum in the rotor chamber, and you're going to slow it down. It's going to get sluggish. Same rule, dropper, smaller the 2 holes is fine. And this is where droppers are made for. They're made for low speeds. It's a little bit more viscous than a spray. And low speed heads, again, not glamorous, but this needs to be done. It's simple. All of the low speed heads are going to break. There's a nut right here in the middle that's going to unscrew. That's going to expose the transmission gear, and then just a couple of drops of oil under the gears in the hole. And you want to drip some oil down into the ball bearings that are in the head. So that's simple. Again, once a week is fine. You don't need a lot of oil. A little tip on low-speed nose cones. All the manufacturers say that their nose cones are maintenance-free. Well, that's great for you until they become full of rust because they're never oiled. So we would say this: take the lube tip from a high-speed spray can, insert it in the nose cone, and give it a good squirt. Oil is going to come out everywhere, and the inside is saturated. It's really going to cut down on the rust and corrosion. So rust is the worst thing that can happen to your handpieces. And then we were just going to talk about what happens when your handpieces do break down. No matter how good a maintenance you do, you're always going to have handpiece breakdowns. And so you've got a few options. There's a do-it-yourself, and there's sending it out. And when we say do-it-yourself in the office, you've got options there. You can purchase a brand new turbine from the company that built your handpiece. So we would call that OEM. So it stands for Original Equipment Manufacturer. An OEM turbine is going to be very expensive. It's also going to be very well made. You can buy a cheap generic turbine. That means that someone else made it to fit someone else's handpiece. In this case, I would say you definitely get what you pay for. So, that's an option. And we have some customers that actually rebuild their own turbines. I'm happy to sell the parts to do that. Some people like doing that, some people don't. If you're going to send it out, you've got options there. You can send it back to the company that made your handpiece. That's arguably the best you can You can send it to like a large dealer. They have centralized repair centers. That's another option to save you some money. You can find, somebody on the internet to send it to, or you can use a friendly local handpiece guy like me. Just kidding. Let's talk about doing it in the office. If you use a new original turbine from the manufacturer, you're not really saving any money, but you are saving turnaround time. So you have a turbine in stock. Excuse me, maybe at lunch hour you have a chance to open the handpiece, clean it out, put a new turbine in. You never have to send it anywhere. It's right back in the rotation. And doing generic turbines, same thing. It just saves you money. It does. Rebuilding your own turbines is going to take you a lot of time. It's really not what you're trained to do. It's maybe not the best use of your time and your dental education. So again, if you want to do it yourself, I'll be happy to sell you the parts you need. It's probably not the best investment for your time. Excuse me. If you send out your handpiece back to the manufacturer that built it, you are going to get the best possible repair. They're the people that made it. They know how to make it. They know how to fix it. The only disadvantage of the manufacturer, and I was a rep for 10 years, I get tired of people yelling at me because it's very expensive. The manufacturer says that they want the handpiece to leave there meeting original new factory specs. So it's going to be like new, but that's going to cost you a lot of money to get it to that point. And right now, we work with these guys all the time, and some of them, that's not an exaggeration, some of them are 4 weeks, some of them are 6 weeks, some of them are 3 weeks, not fast. Customer service is not there because you've got to go through a dealer. Usually you're not getting to talk to the technician, the guy with the dirty hands. So anyway, that's that. I don't recommend the cheap generic turbines used by anybody. To me, it's like you spend a lot of money to buy a really nice car like the BMW, and then you put a Yugo in it. It's just, you're wasting your money. Either don't buy the nice car or don't buy the cheap turbine. If you're using a large company that you're not, that's not sort of local and small, communication can be a big factor. There's a lot of communication that goes back and forth. I'm going to call and say, hey, what did you mean by this note? Or did you want an estimate? There's a lot of, the handpieces have become really kind of the lifeblood of your practice. And so you've got a good investment in the handpieces. You use them all the time. It's something that becomes to mean a lot to you, and you want to feel good about getting them repaired. Oh, look, here's a small family operator repair service. You're going to get good customer service. We turn everything around in 1 day. You're looking for experience, and you're looking for people that have a relationship with manufacturers. And probably the biggest thing about using an independent is that you can get what you want done. Not like, as I said, the manufacturer tends to do everything, whereas smaller companies are going to offer you a menu. If you don't want this fixed, fine, we'll just do that. So it's a bit more tailored to what you want to do or what your budget might be. So those are your options when it comes to repair. That's it. Time to wake up.
No, sir. No rest yet. Got the first of our questions coming in. I think you're going to enjoy this one. This is the first of the questions I want to start you with. At school, we have a two-piece high-speed system, the handpiece itself and then the coupler. There's some controversy among the students about whether or not to sterilize the coupler. What are your thoughts?
That's a great question because that's a controversy in the industry, not just at your school. The current FDA guideline is to sterilize that which goes into the patient's mouth. So it's been pretty much, the consensus is you don't sterilize the coupler, because if you sterilize the coupler, then you have to sterilize the hose, then you're working backwards. So the handpiece is designed to be easily separated and sterilized. The coupler doesn't go into the patient's mouth technically, so it's not required to be sterilized by the FDA. So that would be my answer. But it is somewhat, people discuss it all the time. And the couplers are made, they can be autoclaved, but it's not practical to have to unscrew the quick connect. You'd have to buy more of them. They'd have to unscrew on and off the tubing. It would be impractical, let's say.
Okay, Glenn. Next question. When it comes to the failures, do they start to break down all at once, or is there a gradual process? Can you describe some of those signs and symptoms?
I love that question because yes, it is a gradual process, and every day I say, doctor, if you'd only sent this in sooner, it wouldn't cost this much. So yes, I would love for clinicians to recognize, and the factors are going to be, I'm going to tell you the notes that we get written to us on our work orders when the handpieces come in. We get words like not concentric, wobbly, wiggles, vibrates. As soon as your burr stops turning concentrically and starts to, wobble on you, that's a sign the bearings are going. You're going to hear an increase in the noise, and you should feel it in your hand. I have a ton of respect for dentists after all these years, what they can tactily sense in the handpiece. My hat's off to them. And so we have the ones that are really, really sensitive. They send us the handpiece in, and they say it's not working. I run it. It sounds great, but when I touch it to our testing material, it stops immediately. I take it apart, and the cage has a tiny little fracture in it, and that dentist could feel that. And then we have the guys who send them in, and they say not working with a question mark, and that thing it's dust. It won't even turn. So there's quite a spectrum of users out there, but yes, you can absolutely tell when it's going, and we would urge you to send it in sooner rather than later, because when the bearings go, everything else gets damaged, and then it becomes a whole replacement versus a repair.
All right, Glenn, there's a whole series that are coming in based on this basic concept, so I'm going to ask it a couple of different ways. Mike, one of these is yours, so hold tight. We'll get to that in just a second. But from your perspective, Glenn, are there certain features that are, as you think about it, that are more important to a dentist who's going to be using this on an ongoing basis, part of the lifeblood in the daily practice?
Features that are most important. It's going to have to fit your hand shape, and that's something that's very unique. And I was expecting someone to say, "Well, what's the best handpiece?" And my answer is always the best one for you. I mean, so
that's the next question.
Well, so I'm biased. I worked for Star for 10 years. I think it's the best value on the market. It's made of stainless steel. All the other handpieces are nickel-plated brass. They're softer and heavier. I mean, we can talk about those kind of features and benefits all day long, but it's got to fit you. And they're becoming more and more ergonomic. Like this picture of the NSK on the slide here, that's a really good shape. So head size is very important. One of the things that we're seeing now I think it's really great for the practitioner is the multi-port water spray. So the water is coming all around the burr, and it never gets blocked by the tooth. If you go distal, you still have water on the backside, and it's coming down and irrigating the burr. So you don't have to worry as much by the tooth structure blocking the water spray. I guess, here's the trade-off for whoever asked the question. Doctors want power so they can get done fast, but the bigger the head, the more powerful the handpiece. With a large head, the trade-off then becomes access and vision. You can't see what you're doing. You can't get it where you need to get. So there are small heads, and you have better access and visibility, but they're not going to be as powerful. So these are the trade-offs that you have to decide when you're feeling a handpiece. And I sold handpieces for 10 years. I would never buy a handpiece if I didn't try it first. And I just had a doctor, wanted to buy some handpieces, and I said, nope, you have to try it. I'm not going to sell it to you until you have used it, because they're so different in how they operate. It isn't so generic that you can just say, oh, here, a handpiece is a handpiece. That's not that way at all. You've got to try it out. And any company that won't let you try it first, I wouldn't do it. Go somewhere else.
Are there areas that you see on a handpiece that are more frequent? Is it always the bearings? Are the fiber optics ever in question?
Always the bearings. And that's hard for my clients to understand, because let's say we charge $99.95 to replace the bearings. We get questions like, well, geez, Glenn, you guys aren't fixing it right, because it's the same cost every time. Shouldn't you be fixing something else? And the answer is no. There's only one moving part. That's all there is to fix. So it's bearings 90% of the time. You can have chucking issues where the burr is being released, and so now you're into a patient safety issue. if the handpiece is letting go of the burr while you're cutting, that's very dangerous. So that's another type of repair. Fiber optics, very interesting because they're going away. Almost everybody, so we used to do a large business of replacing the optics. They will degrade during sterilization. Two things happen. All the manufacturers now have come out with cellular optics, so they're no longer glass fibers that are bound together by epoxy. They're actually solid glass rods, so they physically can't degrade. But if you drop them, they can break and shatter. So they are fragile, but they won't get dark. But we've quit replacing optics now because almost every single dentist is going to a headlight system, usually maybe in combination with loops. And so a lot of times we'll say, doctor, these optics are dead. Do you want them repaired? Nope, I got a headlight. So the optics are sort of becoming a moot point. And we're seeing more and more non-optic handpieces coming onto them, that we see now. People are just saving the money and not buying optic handpieces.
From your expertise, do you see air or electric more often?
Well, just air is the predominant thing. As I said, electric has grown to become 18% of our business last year, and it is taking over. Once you buy an air system, you cannot go, once you invest in electric handpieces, you cannot go back to air. The power difference is just, it's tremendous. But the problem is for a doctor that's in existing practice, I talk to a lot of guys every day, and it's a big investment. You're talking about $3,500 for each unit, motor unit for each room, and then each handpiece, like you see picture here, is about $1,500. So it's a really significant investment, and it's hard for that's the barrier to entry is the cost.
If you're maintaining a handpiece well, what's its expected life?
There's the question I get every day. Okay, did you see the slide about all the variables? So I can never answer that question, but I'll answer it. A year. So I'll just say a year. I mean, it's not great. It's not what people want to hear. They want to hear 5 years, 10 years. So we do a 1-year warranty on the lube freeze, and they last about 18 months, 2 years. Doctors are happy. We do a 6-month warranty on the lubricated, and it's going to go a year, year and a half. Doctors are happy. So everyone's sort of gotten into the understanding that you're going to be fixing a handpiece about once a year or, once every 2 years.
Okay, final question tonight, Mr. Williams, comes from your host. When you're involved in the manufacturer's world, where do you see them thinking about improvements in the technology? Where are they trying to make their innovations?
Size. Everything is about getting small. And electric, I'm kidding, but you could say electric was a setback because everything got really big. So after years of making heads smaller and smaller and smaller, the electric motor itself is a pretty good sized object that you've got to hold in your hand. And then with all those gears and everything that you see inside the body, the body's got heavy and they got fat. So that's where it's going, is to get the electric motors down to a certain size. And if I can just say one thing about that, the way their manufacturers are doing that is they're like, for instance, the picture on the slide, everybody can see that, right?
Yeah.
That's a standard ISO universal electric back end. That attachment will go on anybody's electric motor. The way they're getting around the size issue, they're making a smaller, really small motors. Every company has a small motor, but that motor is no longer universal. You can only accommodate their handpiece, and that's one of the ways they're getting them shorter and lighter. But I have a real problem with that because I hate getting locked into a brand like that, especially with the expense that I just said. If you're buying a $3,500 motor and then only that company's handpieces will fit on it, and then you get mad at that company or someone else comes out with something better, that hurts. And I've been in that situation with a previous manufacturer. So size is getting them down to size and weight is the biggest thing with electrics.
All right. Well, Glenn, thank you so much for your time and your expertise tonight. If you wouldn't mind just closing by advancing us one step further.
Okay, and thank you for the opportunity, Rich. I appreciate it.
Yeah, you've been a wealth of knowledge. We're very appreciative of the time you spent for us on a holiday Tuesday evening to share some of that knowledge, answer our questions, and a really informative conversation We've had some really nice remarks from the students just shooting some notes off to us on the side, and so they're very thankful for your role in making tonight happen. So thank you. Certainly a special thanks to our sponsors at NSK Dental, who wanted to help bring this very experienced and knowledgeable presenter to all of you as future docs. Certainly would like to thank them for their educational grant. And if you wouldn't mind, folks, before you leave this evening, as you're jotting down some of Glenn's last recommendations, please do take the time and complete the post-event survey so we can continue to bring you this great information on a recurring basis.
All right. Thank you. Good luck to you, doctors.
Thanks, everyone. Have a great evening. We appreciate your time. Good night, everyone.